Thank you for your interest and attendance. I'm Gary Kotz from Rockford Health System. With me is Mr. James Moore, from the CEO of OSF Healthcare System, and Dave Schertz, CEO of St. Anthony's Medical Center. And it's nice to see this level of interest. We have some news that we want to share with you today. And for me, it's really interesting because I came to Rockford in March of 2000. And my third day on the job, Dave and I and Bob Klint from Swedish American were part of a panel at Northern Illinois University moderated by the Dean of the School of Nursing, talking about how this community could figure out a way to have their health providers collaborate. And it's nice to be here 11 years later to talk about this announcement. And it's an important day for healthcare in Rockford, and we're gathered today to announce that an affiliation agreement has been signed, setting the stage for the joining of OSF Healthcare System with Rockford Health System. And it means that months of due diligence and thorough study and involvement and energy from the boards of both institutions to identify the fact that we should move forward together to significantly enhance the medical care delivery system in the greater Rockford area is important. And so our goal is to immediately begin the state and federal regulatory processes necessary to bring this affiliation to fruition. Last May, as you'll recall, we outlined our combined vision. That vision has only gotten stronger through the due diligence process. We want to ensure that Rockford is a regional destination for healthcare for many years to come. We'll be forming the OSF Healthcare System's Northern Region because we're convinced that the combined organization can create innovative centers of healthcare excellence and clinical service of the very highest quality, rivaling those in much larger metropolitan areas. For patients and families, it means receiving the highest level of care close to home, and it is really as simple as that. We believe this affiliation is about what's right for the community. We think that combining our talents, our resources, our technology, our facilities will allow us to more effectively tackle the tough challenges ahead in healthcare, and not only the challenges ahead in healthcare presented by the component parts of health reform, but also our local economy and some of the issues going on within that. We know that this will help the Rockford region and its health system become much more secure going forward. We also realize that it is imperative that we have the support of our combined medical staffs, our combined employees, our combined health professionals who are seasoned, well-educated, well-informed, well-motivated, that know that it is very important that we collaborate on these moves going forward. We really look forward to their involvement and know that their involvement will lead to a successful endeavor. Among others, two very important commitments were made by OSF as part of the affiliation agreement. The first is that a community board of directors that will govern the OSF Northern Region. Its members will come from Rockford and surrounding communities and will include physician representation from both hospital medical staffs. Maintaining local governance was key to the Rockford Health System Board in these negotiations. And secondly, a commitment has been made to continue operating both hospitals on both sides of town. What's to come? First, combining two large organizations, which will represent a workforce of over 5,000, is complicated and exciting work. Federal and state regulatory approvals, including those required by the Hart-Scott-Rodino Act and Illinois Health Facilities and Services Review Board, are expected to take at least several months to complete, if not longer. What lies ahead will be a massive undertaking. I want to personally thank the OSF Healthcare System Board of Directors, the Sisters of the Third Order of St. Francis, the Rockford Health System Board of Directors, and the leadership teams at OSF Healthcare, OSF St. Anthony Medical Center, and Rockford Health System for their diligence and dedication to this extremely lengthy and complicated negotiation process. We have done our homework and are very optimistic that this transition will come to fruition and completion later this year. And now Dave Schertz will talk about what we've learned about each other and what our shared vision for the future is. Thank you. Dave?
Thank you, Gary. Well, certainly I've had more than a few people ask me, well, it's been 8 months. What's taking so long? We've gotten to know each other very well over these last 8 months. And we have to look for a common vision. We have to look and see that our cultures can come together. We have to look at, certainly, do we share the same values? And that's been confirmed in these last 8 months. Beyond that, we've also seen that we all have pride in our organizations. That pride, that energy, that acts as the fuel going forward to pursue a common vision. We are very enthusiastic about what we've learned. Certainly, our medical staffs, I've heard from our medical staff and from Rockford Health medical staff members, they're very enthusiastic about the potential and opportunities. They look at the same realities that we look at, the changing nature of healthcare, and certainly over this last year, we've come to a much greater understanding of the impact of healthcare reform and what it will do to us going forward and what we must do to deal with it. And the best lesson we have learned is, with that future, we face it much more resolutely and with confidence as partners than trying to deal with it alone. So, quite frankly, we think this is an opportunity. This is an opportunity not just for our organizations, but for the entire region. We have a lot of steps to still go through. As Gary said, we still have to go through state and federal review. But our objectives going forward are these. We want to significantly enhance the quality of medical care delivery in the northern region to the highest possible level. We want to become the destination for healthcare service in this region. In other words, you won't need to leave Rockford for your health care. That has ramifications not only for the advancement of the quality of care, but it has huge economic significance for an area that, quite frankly, is struggling. We think we can be a real engine for renewal. We think that combining our talents, learning about the best practices of both institutions, will lead us to the best operational model, something that will, as I said earlier, take us to the next level of quality care. And quite frankly, this is an ownership issue too. I think we can build something here that everybody in the northern region can feel a part of, can feel a sense of ownership, participation, and that's our employees, our medical staff, and most importantly, the communities and patients that we serve. So, over the next several months, as I say, we'll be working through some of the final legal barriers, but this day, at this point in time, we have come together of one mind to say this is the best way forward. So we're very excited about that. And now I'm going to ask Jim Moore, the CEO of OSF Healthcare, to come forward and say a few words.